This is the day the Lord has made. We shall rejoice and be glad in it. First, giving honor to God, who's the head of my life, our pastor of this great church, Reverend Dr. Blakely N. Scott, to the greatest First Lady, Mrs. Mary Scott, officers, members, friends, guests, virtually and in present, welcome. My name is Jamonica Taylor, and I bring greetings on behalf of the Women's Day Symposium Committee. Thank you for joining us on this Saturday. You could have been anywhere, but you chose to be here, and we are grateful that you are. Today, we're here for our Minority Health Symposium. Our theme for today is Stepping Up to Overcome Healthcare Disparities. Our scripture is Psalm 46, verse 1 and 5. God is our refuge and strength, an ever-present help in trouble. God is within her. She will not fall. God will help her at break of day. A growing body of research shows that social determinants of health, such as access to quality health care, education, social connection, healthy food, housing, wealth, and employment, play a key role in health inequities within our communities. We hope that you take the information shared on today and educate others and encourage them to step up and overcome healthcare disparities. Thank you.
Good morning. May we pray. Eternal gracious God, our Father, God, we just thank you for another day that you allowed us to wake up and to see this day. God, a day that we didn't know if we would wake up, but you saw fit to do that. So we're so thankful and we're so grateful for all of your goodness and all of your tender mercies that you continue to bless us with day in, day out, over and over again. And Lord, as we get ready for our wonderful Women's Day Symposium on today, God, we ask that you just be with each one of these ladies that are represented in their own way, God, that you be with them, that the knowledge that comes out of them and out of their mouth with their word, that they be words that can impact on our lives, that help us to be better at taking care of ourselves and help us to be better aware of what's available for not only us, but others that we might know. We ask that you strengthen them, God. We ask that you give them whatever they need to present in whatever way they need to, that the word will go forth, and that your glory will be given to them, God, and that your peace that surpasses all understanding will be within each one of them to radiate out to each one of us. God, again, we just thank you for what you're about to hear and what you're about to see. And God, for those who are on their way, we just pray for traveling mercies, that when they get to these destinations, everything will be all right. In your son Jesus' name we pray. Amen.
Good morning. Rhonda Sims, affectionately known as Ro, is a passionate activist, wife, mother, and forward-thinking disruptor in the realm of reproductive justice and maternal health. As the program manager for outreach within the Preeclampsia Foundation for Mama's Voice program, Ro dedicates herself to fostering organizational partnerships that advocate for quality improvements in maternal health. Ro's maternal health advocacy began after grappling with severe depression and anxiety following the heartbreaking loss of two women she knew due to conditions called preeclampsia. Since then, she has been actively working to create space for conversation and education on the equitable maternal health practices, with a particular emphasis on amplifying the voices of women of color. Key highlights of Ro's impactful work include serving on the focus group of the national campaign, The Gathering Table, serving on the South Carolina Birth Outcomes Initiative Patient Safety Work Group, member of Mom Congress, holding a community engagement seat on the committee with National Institute of Health Improvement, which is CHIP, and founded and created the first celebration of Columbia Black maternal health the week of April 2024. A graduate of the University of South Carolina and a licensed realtor, Rowe resides in Columbia, South Carolina with her spouse, Jermaine, a U.S. Army officer, and their 4 children. She is also a proud member of Delta Sigma Theta Sorority Incorporated and an active parent of Richland II School District. I present to you our moderator, Rowe Sims, affectionately known as Rowe.
Well, I'll say, what time is it? It's like good morning still. So good morning to everyone. I'm excited to be here. I always say I don't worry about accolades. I worry about community, and community is my purpose in serving everything that I do. I'm excited about the amazing women that sit on the panel with me today, and we're excited to share with you some of the things that we know and that we've experienced in the community, and we're excited to connect with you guys in your Women's Symposium. So I'll open up first. I think, is Dr. Tisha going to start us off with her overview on health inequities and disparities?
They advance. All right. Good morning. Thank you so much for having me here today. I'm going to give a very brief overview about health disparities and health equity. We use these terms a lot, and so I can't help it. I'm an educator, and so I just want to give you some definitions to kind of start the process of the conversation that we're going to have today, and share a little bit about some disparities that we experience in the African American community, as well as some solutions, which again, we'll continue to talk about today, ways that we can improve our health in the African American community. Okay, health disparities among African Americans, where we are, and potential paths forward. Next slide. So again, I've kind of given you this already. We're going to talk about some of the terminology, some examples, and then also some paths forward. Next slide. Next slide. Okay, so what is a health disparity? So basically, a health disparity is just simply a difference in some type of outcome. So, many times when we look at statistics, we are often compared to non-Hispanic whites. And so those are some of those examples of, showing the differences in our outcomes, showing differences in terms of health outcomes at a population level. Next slide. But health equity is a term that we've been using a lot more lately, and I like it too because it is a more positive term. So instead of kind of approaching our health from a deficit, we're focusing more on solutions and how we can improve it. And so health equity is really about fairness and justice. It's about giving everybody the same opportunity to be healthy. And currently, where we are, we don't necessarily get the same opportunities to be healthy. So again, we'll be talking about some of these issues today. Next slide. So what determines our health? So I know that, we think about different things that determine our health, but what is really interesting is about half of what determines your health are your own health behaviors. And again, when we start thinking about health equity, sometimes because things are more disadvantaged in certain communities, everybody doesn't have the same opportunity to perform certain health behaviors. So that's why we have to talk about this at a higher level, not just, you making a decision to eat a fruit today versus Bojangles. It's bigger than that. It's that certain communities have more Bojangles than they have grocery stores. So we're going to be, again, talking about that, but just keep in mind that most of your health is determined by your own health behaviors. I think we always think about the genetic piece, but it makes up less than 10% of your health. So again, there's systematic things that need to happen, but there's also things that we can do in our own individual lives to improve our health as well. Next slide. So of course, health is political. I know when I was deciding to go back to school, I had no idea really how political health was until I started doing work in health. I think I was assuming that everybody cared about everybody and everybody wanted everybody to be healthy. But there's some terminology around called the political determinants of health. And those determinants actually impact the social determinants of health, which we'll talk about. But if you look at this figure here, it basically just shows that there's these three components. So it's government, policy, and voting, and then advocacy is always ongoing. And so this is another area where when we start talking about how do we improve health outcomes, we also have to think about things from a much higher level in terms of looking at policy and how it impacts access to health. Next slide. So we've all probably heard of the terms social determinants of health. And so the social determinants of health are basically where people are born, live, work, play, worship. So kind of where you are situated on a daily basis. And so what I want to show here is that, again, you're talking about neighborhood, education, healthcare system. But if you look at the figure, across all of those different domains is racism and discrimination. And so we know in every single one of those areas, there's some form of racism and discrimination that is going on, and we know that that definitely directly impacts the health of African Americans. Next slide. So, and I think this is probably something that we're more familiar with than some others, but there's different forms of racism. And I think when people talk about racism, especially I think in the political arena, they just focus on these one-on-one situations. So those situations where somebody's got their cell phone out, they're recording, somebody being disrespectful to somebody else. That is a form of racism, but that is not the form of racism that is impacting our health as a community. Those higher levels of racism is more at the systemic area, the structural area. So again, those policies, and how those policies inform, healthcare policies, all those different things. So that is when we're talking about racism, particularly in health, we have to remember that there's multiple types of racism. And again, we try not to narrow it down to just these one-on-ones. Those things do impact our health, but it's really way up here is the place that we need to make impact. Next slide. And then, of course, the term around intersectionality. So we're not all just African American. I'm an African American woman. I'm 44 years old. I am a mother. I am a wife. All of those different things make up who I am. And so, again, we're thinking about impacting our health. We have to think about all the different dimensions that each of us are and how our health is impacted by those different dimensions. Next slide. Okay, next slide. And so here I'm just going to give a couple of overviews of different areas of health disparities, and many of you may already be aware of this. What I was looking at is the leading causes of death, particularly by race and ethnicity. And in the Black community, heart disease, cancer, and COVID actually are the leading causes of death. And if you can see that, I put in red, you can see that our rates within our own group are higher in comparison to other racial ethnic groups as well. So if we have heart disease, we have it at a much higher rate than other communities, and the same for COVID. Next slide. And so, so in terms of heart disease, we know that more than half of African American women aged 20 and older have risk factors for heart disease. And unfortunately, also that we're more likely than white women to be diagnosed with diabetes. And we know that South Carolina is one of the leading states in the country in terms of diabetes. And then we also know that not necessarily maintaining a healthy weight is also a key risk factor for heart disease. Next slide. And this, I think, is a statistic that we probably have all heard. We know every October there's some discussion around breast cancer. But what I think is absolutely something that we should be ashamed of, particularly as a country, is that Black women are less likely to be diagnosed with breast cancer, but we are 40% more likely to die from breast cancer. And again, there's a number of factors that play into that, which we'll talk about. But some of those things are access to care, and that because of that, we may have later stages of diagnosis when we are diagnosed, and also racism. Next slide. And so we see similar patterns for men. So in prostate cancer, you can see that the death rate, so it's the blue line at the top, it's much higher than all other racial and ethnic groups. And prostate cancer is not nearly as lethal as some other forms of cancer. And so this is also very troubling, given that there's many opportunities and ways that we can treat prostate cancer. Next slide. And so then in thinking about COVID, I wanted to highlight that, again, our death rates from COVID are significantly higher than other groups, but I also was looking into the rate of vaccination. And so we know that vaccination can have a positive impact on your risk in terms of COVID. And so across racial ethnic groups, Black Americans have lower rates of either having any dose of the COVID-19 vaccine. And of course, there's many reasons for that, but I just want to point that out, that it is also an area where we are a little behind in terms of comparison to our counterparts. Next slide. And so, of course, we look here, I'm trying to see, I didn't have to put my glasses on, that the black bar is more the navy blue bar, and so you can see in terms of cases, we're kind of somewhere in the middle, but we have an increased rate of hospitalizations, and we're also have a high level of deaths. So again, this is directly tied to some of these barriers to care, as well as some of the low rates of vaccination. Next slide. And of course, when we talk about health disparities, I know we've all been hearing a lot about maternal mortality, particularly in the Black community. Again, kudos to Roe for helping to establish Black Maternal Health Week here in Columbia, for us to continue to make this an issue that we're very aware of, and we also know how to help other Black women. I've heard many stories of women, particularly Black women, who are afraid to have children right now because of all this conversation around Black maternal health. But I will say that most of the reasons for those deaths are highly preventable. And so that is where we need to kind of focus and make sure that our women are receiving the care, support that they need during pregnancy and postpartum. Next slide. So trying to leave on a much happier note here, how can we reduce health disparities? And there's absolutely ways that we can do that. And so I love this figure because it shows you the difference between, so reality is you see this, and this is really where things are now. You've got certain groups who have a leg up. They're way up there at the top with all the boxes standing on top, and everybody else is either on one box or under the ground. Health equity is the place where we give people what they need. So when you give people what they need, you can see that the one person has the one box, the other one has two, because he needs to be a little taller to be able to see over the fence. And then with equality, which I think is what our country seems to focus more on, is trying to just give everybody the same thing. But that is actually not fairness. Because you see, when you give everybody the same thing, people still can't see over the fence. And what I love is that there's now so much more conversation around liberation, where there's no fence. So we break down the barriers, again, those higher level things that can prevent us from being able to participate. So next slide. So just a couple of things that I think that we can do to address these health disparities. Number one is knowing your family history. And I stress your biological history, because I think we have an amazing history as a people of caring for our own and other people's children and families. So we have, a very strong value of kinship care. However, your kinship care is not necessarily going to tell you the truth about your family history. And I'm sure many of us have situations where you found out somebody was somebody else's daddy and you didn't know that, and and those kinds of things are problematic when it comes to health, particularly if you have some type of genetic predisposition for something, and you have no idea that that runs in your family. So I just stress that we have to have very important, critical conversations in our family. And some of the work I've done with breast cancer survivors, Black women in particular, some of them told stories of the fact that they had breast cancer, and not until they got diagnosed did they find out their mother had it, their grandmother had it, and their aunts had it. And it was unfortunate because they could have, sought care much earlier and made sure that they were, staying up on their screening. So I just stress this, that this is really important for us to have those conversations. Next slide. And so following public health recommendations. Now, this is always easier, sounds easier than it is. So again, physical activity, these are things that we already know. Physical activity, eating healthier, knowing your numbers, going seeking health care as a preventative care, but also whenever you're not feeling well, making sure you get quality sleep. Sleep is something that is being researched more now than ever, and it really plays a role in, sometimes you have cravings because you haven't had enough sleep. You may drink more caffeine. You may want the chocolate cake, all those things. And so we have to make sure that we are getting the proper sleep, but also reducing our stress. And we know also from a research perspective, Black women, we in particular, have really high rates of stress. We're often balancing so many things. We're, again, doing so many things in our community, but also in our families. And so we have to work on figuring out ways that we can reduce that burden. Stop smoking, which seems very obvious, but in some recent statistics, actually Black males are the leading population who have the highest rates of smoking. So smoking is not as prevalent as it used to be, but among smokers, Black men are the lead in terms of smoking. So that is one area that we could also help educate our family. And of course, maintaining a healthy weight, and if you eat well, you do physical activity, that will inherently happen. Next slide. Also, we need to educate and train healthcare providers. Part of the issues, particularly that we hear about in maternal health, is that Black women don't feel seen, they don't feel heard, they're being dismissed when they're discussing different symptoms that they're having. And so part of the need is to educate those that are already practicing, but we also need to diversify the pipeline. And so for all of you, there are young people in your life, and even you don't have to be young, you can go back to school anytime. But we need to encourage our kids to go into these fields. We need more people that look like us helping and serving us, because we know, again, from a research perspective, our outcomes are much better when we are being treated by people that look like us. Next slide. And this may seem very quaint, but again, thinking about the political determinants of health, voting can actually impact our health. I think that there's a lot of people who feel like voting doesn't matter, and because they think that, few people show up to vote. And so we know that voting matters, and it will translate into policy. And so we need to make sure we have the right people in office so that they will be the ones who are shepherding important policies that can better improve our health. Next slide. And with that, I'll end my presentation, and I think we're going to have one more presentation to follow, and then we'll continue this dialogue. Thank you.
Everyone. And thank you, Dr. Felder, for that overview of why it's so important for us to understand and recognize our health and health disparities and those inequities that we face as a people. I'm Nikki Brown. I work for the Department of Health and Environmental Control, AKA DHEC, the agency's Chief Inclusion Officer. And I have some similar slides to Dr. Felder, so I'm not going to go into too much repetitive details of it, but I wanted to reframe some of those same concepts that she just delivered. So. So I want all of us to imagine a river while we're waiting on the PowerPoint. And picture yourself observing its flow from two distinct points, upstream and downstream. Upstream represents that starting point where various factors come into play. Dr. Felder just talked to us about those political determinants of health. Those institutional inequities, such as corporate and business, our government agencies, who really have the responsibility of forming policies around what our health priorities are. And those institutions are at the upstream of our river. So the upstream, they refer to those root causes of health inequities. They are factors that shape our health from the beginning. They include elements such as socioeconomic status. Next slide, please, thank you. Access to health, and other conditions in the places where people live, learn, work, play, worship, and age, those social determinants of health, which can create an uneven playing field in certain communities. Those downstream factors, so mortality, disease, injury, our risk behaviors, those are the outcomes that we observe from those upstream factors. So health disparities emerge as differences in those health outcomes. In some groups, like the Black community, they may experience higher rates of diseases, shorter life expectancies, and other access to health care due to these disparities, such as the ones that Dr. Felder just highlighted. Next slide. So she also talked about this a little bit more, but what I wanted to highlight about this slide is that 80% or so are those determinants or factors that have nothing to do with medical, right? So healthcare and social care make up about 20% of our overall health. And that other 80% are highlighting education, employment, family and social support, the communities that we live in, so air quality and water quality, transportation, housing, and then we talked about those health behaviors. Next slide. This matters because we need to understand that link between those upstream inequities that lead to those downstream disparities, okay? And we use those terms inequity and disparities interchangeably sometimes, but there are key differences because colonialism and capitalism weren't set up to accommodate for people of color. And if we address those upstream factors, we're really creating a society that is fairer and healthier. Next slide. Dr. Feller also mentioned this concept of equality versus equity versus, she called it liberation. We refer to it sometimes as justice too. So that's removing that fence altogether so that we can, in this image, they're trying to watch the sunset. Removing that fence altogether so that we can enjoy it where we are with fairness. Next slide. So what I want to do is highlight a resource that is specific to our state. And every 5 years, the state, DHEC, and some of its many partners, they create a report. It's called the State Health Assessment. And this health assessment is a tool for community members to use to get specific information about all kind of things, y'all, from vehicular incidents and deaths, cancer, all types of cancer, diabetes, all the things that are impacting our state. And what I really love about this resource is that it is heavy on highlighting those disparities. So I want to take some time with y'all today to just highlight a few, because it's a long document. It's long. It's a few hundred pages. But highlighting just a few of those data points that is highlighted. Next slide. So the first data I would like to highlight is what the people have indicated as the most important health issues in our state. These priority areas were collected at county data walks and other community outreach events where people were having discussions about, hey, what are we going to do about our mental health issues or this opioid epidemic that we're seeing as a state but also as a country. And they listed 3, and there were a tie, 4 indicators. So that was access to care, obesity, nutrition, physical activity, substance abuse, and mental health. Next slide. So now I'm just going to talk about specific data that is impacting our state. And this data is statewide, and the first one I want to highlight is maternal mortality. In South Carolina, Black women had more pregnancy-related mortality rate. They have a pregnancy mortality rate of 48.9 deaths per 100,000 live births, which is a 67% higher rate than our white counterparts, which their rate is at 29.3 deaths per 100,000. Similarly, Black babies, next slide, are dying just as high. In 2021, the overall infant mortality rate for South Carolina was 7.3 per 1,000 live deaths. This rate is the highest for non-Hispanic Black infants at 12.7 rate. So that blue line on the slide indicates how far of a gap our babies are dying from Black birthers. I also want to highlight some of our diabetes data. 80% of adults in our state live with diabetes are overweight or obese. Diabetes affect 1 in 5 Black people compared to 1 in 8 white people in our state. And Black people die from diabetes 2 times higher than white people. This prevalence is higher in diagnosis of children, teens, young adult, and is partly due to obesity, so our nutrition. And nearly 70% of South Carolina counties, who they call it, we're part of this diabetes belt, are obese, and that makes them more susceptible to get diabetes. Same with cancer. Just these are some of the risk factors as it relates to cancer. So that tobacco smoking, excess body weight, alcohol consumption, ultraviolet exposure, so not putting on sunscreen. And, sometimes we at least in my family, we used to say, oh, we don't need to put on no sunscreen, we Black, we good. But that is also a myth, and we really need to work better on addressing our skincare against the sun. Poor diet, pathogen infections, and then physical activity. Cancer is currently the second leading cause of death among all ages in both South Carolina and the United States. And Black men assume the highest burden for cancer cases and death. Next slide. This data shows that Black women get screened for cervical cancer at a higher rate than white women, yet Black women die at significantly higher rates than white women. Black women are diagnosed with cervical cancer at a 10% higher rate and die at a 62% higher rate than their white counterparts. White women are diagnosed with breast cancer at a slightly higher rate than, white women are diagnosed with breast cancer at a slightly higher rate than black women. However, like Dr. Felder said, black women are dying at a 40% higher rate in our state and nationally. And then South Carolina ranks 26th in the nation for prostate cancer incidence, 9th in the nation for prostate cancer mortality rate, and it says black men are 73% more likely to be diagnosed with prostate cancer and 128 more likely to die from prostate cancer compared to white male counterparts. And this is for South Carolina. Next slide. Going into some of the cross-cutting data that this report shows, they highlight homelessness. Persons experiencing homelessness, 60% were male, 53% were black, 20% were children, so 1 in 5 children in our state are experiencing homelessness. 16 were veterans, and 12% were victims of domestic violence. Next slide. People in households with lower socioeconomic status have lower income, higher poverty, or lower levels of educational attainment. They spend about 30% of their income or more, and they might lack insurance. So it's important to look at the factor of poverty as it relates to our health. Next slide. This data is looking at the mental health conditions of people based on their subpopulations. So we looked at sexual minorities, so men and women. We looked at their sexual orientation, veterans versus non-veterans, and then some of those other demographic areas. In South Carolina, 29% of women 18 to 44 reported having depression, and it was the highest amongst white women. However, a lot of times we don't report our mental health issues as black women, so there may be some discrepancy in this data. Risk factors for developing depression include during or after pregnancy, personal or family history of depression, having a difficulty or complex pregnancy, unplanned pregnancy, or experience interpersonal or financial stressors. Next slide. When we think about all of these cross-cutting factors that may impact our health, the state assessment also looked at delayed medical care based on our subpopulations. It highlighted that non-Hispanic, black, and from urban and rural counties, so we can see that based on this data that rural people living in rural communities, they delay medical care 15% of the time. And it's due to the cost of care. And it makes it more difficult for us to access when we already know we can't afford it. So I might got this lump under, on my breast, but I'll get to it when I can afford the copay or whenever I get insurance, right? And so there are direct links to poverty and just even being able to afford health care. We also talk about individuals with disabilities, and I just made a comment about underreporting disabilities, and that doesn't mean those visible disabilities, but it also goes for those that we can't see. Like, you can look at me, I wear glasses, so I clearly have a visual disability, but you may not know that somebody is struggling with depression or anxiety just by looking at them, and those are considered disparities as well. People with disabilities have higher rates of depression and other mental health conditions. and more comorbidities than people without disabilities. People with disabilities experience physical, communication, programmatic barriers when it comes to equitable access. An example of this, last Friday, I was at the Health Equity Summit, and there were multiple wheelchair users in the participants. And I watched a woman try to get into a space, but she couldn't get down the aisles because they had put the chairs together too closely. So she had to come out of the room where the presentation was and go around to the side door in order to actually participate in the session. And so it's important for us to recognize that some of our processes aren't equitable to those with disabilities, and we really have to do better. Next slide. So my last couple of slides, I just want to emphasize the role of the faith-based communities. Reverend Scott, I've been attending First Nazareth Baptist Church virtually the last couple of Sundays just to get an idea of the culture of the church. And I want to just parallel like the historical role of African American communities and the church being at the center of it. We know back in the 50s, Reverend Dr. Martin Luther King Jr., he used this strategic approach to engage with faith-based organizations to catalyze social change. And he began that in the church. And so those same grassroots mechanisms, and we're all here for Women's Day and we're talking about health, so clearly First Nazareth, y'all got it together. So we ain't got to worry about that. But those grassroots tactics implemented during the civil rights movements can also be done as we are trying to build solutions that impact our communities. So the church plays a critical role in that as well. And the church are trusted institutions. People come to church, they know who they about to hear talk. They know the people sitting in the pew next to them. And so when we bring health education into the church, we know that people are listening and are going to be receptive to the information. And that is where we can provide those platforms for health and education awareness, like Women's Day at First Baptist Nazareth. And y'all even got a child care center. And those are key things in addressing those social determinants of health. If I want to change my financial situation, but I don't got nobody to watch my children, I ain't going to work. And so you all are providing those solutions for families at the capacity that you can, and that's incredible to me. So some strategies I want to highlight. We talked about health education and promotion programs. There was a study done in 2022 called Faithfully Fit. And what they did was, and this was done in Washington, D.C., but what they did was they targeted faith-based communities, primarily black churches, so AME Baptist churches, and they wanted to train health ministries and pastors and with the tools that they needed to provide education to their congregations. Healthcare, providing access to healthcare, so healthcare screenings, fairs, clinical transportation services. I did see that First Nazareth does have fairs and other health ministries, and so y'all are already doing that. There's a difference between advocacy and grassroots. We can all advocate, like today we're advocating for healthier solutions, but grassroots is that organizing. So how do we get this advocacy into action? And so really considering that, addressing the social determinants of health. I heard this week that they call it SDO, and I was like, oh, that's a really good acronym. So addressing those social determinants, and you all have so many different ministries that build supports within subpopulations within your church. And so getting in those subpopulations to provide education on prostate cancer in the men's ministry, or we talk about breast cancer and cervical cancer, but all of those other cancers that impact us, putting some plugs into those ministries as well, and then also engaging with state and local community-based organizations like DHEC, like Rose organization, all the things that we can do to really connect and build that access. This is just more information about that Faithfully Fit study. The thing I'll say about this, and I love the socio-ecological model. It basically is saying at levels, how are we impacting the individual church members and leaders, and then how are we impacting the community? So some of the methodology in the study, they did environmental scans. So they looked at the community and said, well, how many grocery stores do we have in this community? How many libraries? How many bus stops? And we in downtown Columbia, so we have that access, but a step further was they took a walking tour in the community to see, well, how hard is it for me to get to this resource? What's the barrier, like, with me standing at the bus stop if I'm a wheelchair user? So they did that more granularly as well. And then lastly, I'll just highlight some of these resources that are available to you all through DHEC. There's so many programs that our agency offers, and so I just wanted to connect you all with them today. But that's all I have. Thank y'all so much.
Let's see, I gotta get some. While Nikki's making her way back, I just wanted to introduce the panel so that you can know who's all represented here. Thank you, Dr. Tisha Felder and Nikki, for those wonderful presentations that gave us a very high-level insight overview on what's happening in our community. So to the right of me, I have Ms. Petra Edwards, who is a psychiatric mental health nurse practitioner at Prisma Health. And then, of course, you just heard from Ms. Nikki Brown, who's with DHEC, and myself, Rose Sims, with the Preeclampsia Foundation, and to my right, Dr. Tisha Felder, the Department of Nursing at the University of South Carolina, and then Lieutenant Stacy A. Walker with the City of Columbia Police Department. So many things were streaming through my brain as I listened to some of the presentations that were given, and so many things I want to talk about. I wish we had all day to be able to do this, but we don't. So I want to touch on some of the things that you guys spoke about. First, I want to focus on our cultural beliefs as African American people, because I think that plays a huge part in how we care for ourselves as individuals and how we live from day to day. I think about my grandfathers who did not often go to the doctor, and that wasn't a routine process for them. It was not something that we seen growing up. And I also just remember being a part of a church from Newberry, South Carolina, and in my Baptist church, you know, everybody was okay for the most part, and you didn't express those mental health concerns that were going on. You didn't know of Sister Jameson sitting in the front row and that she was going through anxiety and depression, because we didn't define it in that way. So when we're thinking about cultural things that are happening in our communities, we have to also think about what we were taught and how to rewire that for our children, definitely my children, your grandchildren, as you have grandchildren and nieces. How do you start that conversation about health? So I'm gonna open up the first question, number 5 for us, for you ladies who want to represent, but how do cultural beliefs and attitudes toward healthcare influence outcomes within the African American community? And one of you can just jump on if you want to answer that question.
Hi, I would like to start out. Hi, I'm Petra Edwards, and I would like to start out by saying culture, our culture as African Americans, it's influenced a lot by what has been done in the past. And for example, I would say, like with the Tuskegee experiment, you know, looking back on that, even though I wasn't born, however, it still plays a major factor in our culture. And in regards to healthcare, in our culture, we have not necessarily, like she said, gone to the doctor. We have not followed up with health care because that's just something culturally we have not done. But I would say that in our culture now, I would say more African Americans are seeking health care. However, we still have a ways to go. Um, and with our culture, because our grandfathers, our, you know, great-grandfathers, great-grandmothers, you know, we didn't see them go to the doctor, so a lot of us say, hey, I'm good. I can just pray about it and go ahead. But please know that, you know, within our culture, and I'm trying to make sure I'm addressing this question correctly, but within our culture, our beliefs, they have, again, driven up disparities within our community, because it's like, no, why am I going to go to the doctor because they're only going to give me bad news? That is not actually the case. You go to the doctor to, you know, get preventative care, such as like your mammograms, your cervical screenings, which is also known as like your pap smears, and, you know, for our males, like your prostate screenings, and for everyone, like your colonoscopies, now starting at age 45. Those are all preventative measures that can be done to help prevent these cancerous diseases that could actually kill us as African Americans in higher record numbers than non-African American individuals.
So last month, I did a deep dive on a midwife from South Carolina. Her name was Maud Callan. And she really did a lot of work down in the Low Country, birthing black babies from black mothers. And then after the 60s and 70s came, the government was like, oh, there's money in public health. Let's get some work done. And so there we saw our birth rates being 90% or higher, deaths, maternal and infant mortality, to primarily white doctors coming in and trying to figure out how do we deliver black babies effectively. And they couldn't figure it out. And they really targeted these midwives to help, but they didn't trust them. And they didn't trust them because they were sterilizing or giving black women hysterectomies without their consent. And I say all of that to say that our cultural beliefs and the historical context behind just going into the doctor is centered around distrust. Tuskegee, Henrietta Lacks, there's so many different stories of where healthcare providers have just not cared about our bodies and just did whatever they wanted to because they didn't see us as equals. And that has followed us through generations. And so when we look at where we were and where we are, we know a lot better now because we have access to a lot more. But we still carry that trauma with us biologically, and I can get on a whole thing about that. But and so that fear is still with us, and so that is ingrained in the culture, and so I think that plays a really big role in it influences our outcomes overall because we were guinea pigs for so long. Yeah.
So I just want to co-sign the distrust and just say as well, from a historical standpoint, there's distrust, but we continue to be mistreated as a community. And so the modern day distrust is here too. There's very a lot of reasons why we may be very leery of healthcare research. Even though I am a researcher, the COVID pandemic caused a whole lot of conversation around research and people's distrust of research as well as healthcare. I was going to add another kind of belief system. So I think many of you here probably heard of the idea of the strong black woman, and that in and of itself is somewhat of an attitude and belief that we pass down. So we show up, we don't cry, we push through, we take care of everybody in our families, and again, sometimes even our communities, but we don't necessarily take care of ourselves. And I know where you were going with the biology, because there's been some research showing that, so a black nurse actually developed a scale, a survey questions that measures kind of where you are on the black strong woman spectrum. And those who had very high scores actually had very high levels of their within their bodies were aging. And so statistically, black women are about 7 years older biologically than our counterparts. So I'm 44, but biologically, that means I would be 51. And so I think that I feel like that kind of perspective and that attitude gets passed down, and it's not always passed down directly, but we see it, and it is definitely impacting our bodies, and it does also impact the choices that we make in terms of seeking health care.
And I was also thinking about that mitochondrial DNA. When a woman experiences trauma in her life, our biology changes. And when we give birth to that baby, we pass on mitochondrial DNA to our baby. So that's why biologists and all these folks can trace back the first human, the first woman, based on that mitochondrial DNA. And that trauma is also being passed down from generation to generation. And that's a mind-blowing thing to me. But all of our experiences as women, if we don't, are passed down. And so there's this genetic memory that keeps showing up in our DNA, and that also impacts how we think and how we operate and all the things. So yeah.
There's a concept that we talk about a lot of times in maternal health called weathering. And weathering is kind of when you as a strong black woman are numb to the fact that you're experiencing trauma, and you go through life day to day without addressing those things. And a lot of us are weathering. And as Dr. Felder spoke on, that piece of that concept of strong black woman, we have to notice the trauma and we have to address it, because as we continue to bury it, there's other layers of things that are progressing in that progress that come out, usually physical. So we have to be very intentional about our mental health. But this leads me into the next question. We talked a lot about trust and being able to go to the doctor and being okay with that. One of the biggest things about the position that I serve in every day is that we teach women who've had complications with birth loss or any experiences of a lived experience. It doesn't have to be them directly. It could be someone that they know who's had an issue with complications with pregnancy, but we teach them how to heal from trauma and articulate their story so that they can advocate for other women. And that advocacy piece is huge, even when it comes for yourself, advocating for yourself in the doctor's office, maybe doing research before you get to the doctor so that you can have a list of questions to ask as you're going into your doctor's appointment. But one of the next questions I wanted to kind of address is, how do we get the doctors to actually listen to us during our visit? There's always a cultural conversation differences, which is what we talked about implicit bias and racism. When we talk about diabetes, that's not what we necessarily represent. I always used to hear sugar. Girl, your sugar high, or your sugar is low. Those are the things that we talk about. Those are the cultural conversation differences that we're experiencing in doctors' offices that are happening. And there's so many other segments of that. but how do we get doctors to listen to us during our visits? And what language should we use to have tests drawn to get special referrals, scans, or change in medication?
Um, to feel like you are being heard with your provider, whether it's a physician, a nurse practitioner, or a PA, a physician's assistant, first and foremost, advocate for yourself. Make your needs known, plain and clear. Say what's been going on with you. Also, just take your time and explain your symptoms to your provider. You also want to write it down. Write it down, take notes prior to your appointment and say, hey, this is what's been going on with me, or this is how I've been feeling. And also, if you feel like you have not been heard by your provider, make that known during your appointment, okay? Yes, your provider should talk to you in plain and simple language to where it's easily understood. You as the patient should come away from your appointment feeling like your needs have been met and you have been heard. And you also mentioned about like scans, referrals. So generally when it comes to, I'm just gonna say certain referrals. So generally, if you needed a referral, for example, to like maybe a neurologist or a cardiologist, a lot of times before that referral can be determined, there needs to be generally something that's abnormal, that's indicating a referral. So did you maybe like, are you having memory issues? That would maybe indicate a referral for neurology. Are you having things such as knee pain, hip pain that's been chronically going on? That would mean an indication for like an orthopedic referral. Okay, but most importantly, please advocate for yourself. Please make sure that your provider is explaining things again in clear, simple terms to where you can understand and follow. And if you don't understand, have them to break it down for you. Okay?
I'll add, this is a technique that my mom uses all the time, is she'll have me or one of my sisters attend her appointment with her. Not to support her during the appointment, but also to capture that information as well. So if I have questions that I know she's gonna ask me after we leave the appointment, I can go ahead and ask the doctor that question while we are there, because I'm thinking about it with her. And so I think that's a technique that we can use as well, to have those supported, trusted people who ain't gonna have your business out there in the space with us as we're receiving the information.
So I'll talk a little bit about like there's a concept called the white coat syndrome, like when you go into a doctor's office and you get nervous or you can't remember things that you really want to ask. It's so important that you're already prepared. I know Ms. Edwards talked about document things. Also know that there are levels to organizations, to every organization. So if you're in a hospital base, whether doctor's office, there are levels to every organization that you can kind of supersede. So you have a voice to be able to go beyond just your doctor. If you're not pleased with your doctor, that you can talk to someone who's maybe in patient advocacy in that space. But there are levels all the time. I think sometimes we think that it stops with the doctor, but it does not. Know that there are other persons who are in that space that you may not often see, but they're there as support as well. I want to kind of switch gears a little bit, and I know we talked about the social determinants of health, and that includes community. And one of the things that I can remember, like in 2019, when for me, I really noticed like human trafficking was a thing. Like And as I have a daughter who's 5 now, I'm very paranoid about her leaving my sight in any environment that we're in. So I want to talk a little bit about human trafficking. What is human trafficking? Is it still very prevalent in South Carolina? And what age group is predominantly affected by it? And I know Lieutenant Stacy Walker will definitely lead us in that conversation.
Good morning. What is human trafficking? Well, it is exploiting a person through force, fraud, or coercion. Sex trafficking could be forced labor or domestic servitude. Anyone can be sex trafficked at any age. There is no age, race, or anything. Anyone can be. I know I'm in church, so I have to be good. Parents, we don't realize that these cell phones is nothing more than a computer in their hands. And you think they're just playing a game or sex traffickers, back in the day, I guess we'll say back in the day, when they were looking for children, they'll go to the playground, they go to where the kids are. Now it's the computer. Now it's these sites, the game sites or whatever they know where they are. So we have to be mindful of these phones in their hands, limit their time, know who their friends are, who's on their friends list, who they're talking to. Yeah, check their phones. As children, I have to say back in the day because I'm a little older than most, we didn't have that much privacy. If you were on the phone, you had to pull the cord to maybe go in the room, the bathroom, but your parents knew who you were talking to. We have to be mindful of who our children are communicating with. Know their friends. Let's limit also the time that they spend outside alone. Too often we see that these young kids are, and I'm well under like teenage years, just outside by them. If they're in front of the house, I have to go back in the day again, I'm sorry. But if you're in front of the house and all the neighbors knew each other, that's one thing. We all looked out for one another. And we actually still should be, but we're not. We have to just watch our children.
I think that's helpful in the sense of having our kids have a lot of access to things now, and we did not have that access growing up as much, and they're exposed to a lot more things through social media, and that attracts them to certain concepts of things that they feel like they should be a part of, or things that may fill spaces where they're not feeling loved or feeling nurtured in some areas, which brings us to just having a conversation around gangs. We know if we watch the news every day, there's shootings and things are happening in our community. What is attracting our young people to gangs, and how can family members support those who are looking to, who are in those spaces or considering joining gangs?
Well, of course, there's various reasons why people join gangs. Only they know, but a sense of connection, a sense of belonging, peer pressure. And sometimes they got family members who are in gangs for whatever reason. But again, just as I just discussed about watching your children and knowing what they're doing and knowing who their friends are, we still need to continue doing that. Recognize you should know your child, as we all should, if you talk with them a lot. Recognize signs when they feel a little out of it, they're acting out of order, they're acting more aggressive and angrier than they normally do. Okay, discipline, that's a good word, right? Discipline your children. set up those barriers that they know that they can't do certain things. Um, Set limits so they know what is acceptable behavior. Again, as I just spoke, they're unsupervised out in the streets. We have to look out for one another a little more. There's only so much that the police can do, but we're there. We're there. There's so many things, I was a brownie. Put them in these little organizations, Girl Scouts, Boy Scouts, they still exist. The community, City of Columbia has plenty of things that you can get your children into. We do know sometimes too that, we got single parents and they need assistance. You got grandparents raising their kids. There's so much help out here. I go to community meetings a lot, and it's unfortunate. I see this like the same 3 or 4 people sometimes at the meeting. We have to do better. We really have to do better in our community. Each one teach one. Back in the day, if I was out on the street at a certain time, everybody on the block knew, oh, Stacy, get your behind home. And they made a call before you even got there. We have to get a little bit more of that. Know who these children are out there. Help each other. But again, you got so many different organizations out here willing to assist. You got, again, neighborhood watch communities. Just let's try to get more involved. Thank you.
With that, I feel like parents in this generation of life are like combating a lot of different things that are coming their way as you're raising children, especially in a time where social media is so prominent. I know Lieutenant Stacy mentioned single parents, and just parenting alone is hard. And a lot of times we are faced with challenges even from a mental health standpoint because we're trying to maintain all of this and catch up with the hustle and bustle of work and the after-school activities that our children are involved in, and just a matter of just keeping up with life. So I just want to throw this question out there. What are some of the signs that a person is having mental health difficulty, and how should we address someone that may be experiencing a mental health crisis to seek help? Because a lot of our parents and our caretakers who are taking care of loved ones, I've been there taking care of my father when he was sick and trying to take care of kids and trying to take care of myself, and it was not an easy journey, and you can't hit those moments where depression and anxiety sits in. So how do we notice mental health difficulties among someone that we may be connected to?
So looking at some of the signs for mental health, and I will say this for us as African Americans, that generally you've noticed within your child, relative, sister, brother, mother, that something just didn't quite seem right. But you were like, nah, maybe, she's going through something, or maybe he's going through something. You noticed it. So with that being said, for someone that's experiencing such as like a mental health crisis, which would mean that this person is actively having suicidal thoughts, they have a plan, or they have attempted to harm themselves via overdosing, whatever the suicide gesture may be, then you could bring that person to the emergency room if indicated, and or you could reach out to the National Suicide Hotline, which is a 988 number, just 3 numbers on your phone. And also you could dial 911, in which, law enforcement, EMS, and probably like your local mental health services, they have crisis services, they would join you at that time. But to address someone that may be experiencing mental health crisis, it's just kind of to meet that person where he or she may be at the time. There are several reasons that someone may be experiencing a mental health crisis. Could it be from a trauma? Could it be from, just to kind of, piggyback on the lieutenant here, could it be that someone's in a trafficking situation? Could it be that someone's having, physical abuse within the home? But to meet the individual where he or she may be at that time and just kind of talking to them, letting them know that they, are supported, given that unconditional support. Also, being there for that individual and also just seeking out your local community resources such as like Columbia area mental health, Lexington area mental health, but also other mental health crises may not necessarily just be mental. There also may be substance use. That's another mental health. When you have or you know someone that's constantly drinking or they are constantly abusing drugs, that's another sign of a mental health concern. You also have in the community your local alcohol and drug commission to where someone could go for services to get detox from drugs, as well as alcohol, and we know we also have the opioid epidemic, which continues, along with now we have fentanyl. That is a biggie that a lot of people are dying from. But you do have lots of services that are available within the community. However, generally the biggest complaints that I generally hear is that they take too long to get to me to go to appointments for mental health. Because there are a lot of people who are suffering in silence. And I'm gonna say suffering in silence within our community because we keep it all bundled in because of the stigma that's associated with mental health.
The only other thing that I would add to that, as a person who carries her own mental health issues, is what your norm is, and so if you are having issues or you're thinking about things like, well, I can jump off this bridge today, or I want it to be over or whatever. That's not a normal thought for you. So when you start having those types of internal voices take over your brain, that's a sign that maybe I need to go talk to somebody, maybe I need some help, or maybe I need medication. Thinking about things like ADHD that is impacting a lot of people nowadays, and we just kind of tack it along as, I just forgot this, or I can't stay organized, or my house stays a mess. Those are signs of mental health issues that can be addressed, and those are there are supports out there that can help you get that together.
I know one of the questions that we were going to talk about, and I'll just touch on it a little bit, is like checking on your strong friends. Mm-hmm. Everybody have strong friends. Like, girl, you always got your stuff together. No, I don't always have my stuff together. So being able to allow them the space to be vulnerable and have those conversations is a very powerful relationship that you can create with someone, because she may just have that one person, and that one person may just be you. So being able to reach out when God nudges you, you have that gut feeling, hey, I need to call Latasha to make sure she's good. I need to check on her today just to say hello. And many times I've done that, and it's been the time that they've been like, I really needed to hear your voice today. I really needed someone to call me. So just be intentional about the relationships that are around you, because oftentimes we go through the day-to-day like, oh, she's good, she got it going on, all her stuff, and then we look at social media, and social media paints this beautiful picture that we were at the park and having fun. But in reality, I was in the back of the park crying because I had so many things on my plate to do that day. So just be considerate and careful about people that are in your circle, to touch bases with them and be intentional about that. I want to close out with each panelist just giving us some type of path forward. I am a person of solutions, and that is the best way to get things done. So I'll start with Lieutenant Stacy Walker first. If you can just talk about, like, what is your path forward to address determinants in our community? Because we know that everything that we've discussed is impacting our health as women, our health as black and brown families. So what's your path forward to addressing those determinants in the community?
Well, first and foremost, stick to my oath, is to protect and serve everyone. Also, again, I go to a lot of community meetings. I speak to a lot of youth to keep our lines of communication open and being open to change, because everything ain't like it was back in the day. I guess I should get a T-shirt, say back in the day, huh? Always doing the right thing. Doing the right thing. That's it.
Dr. Tisha?
Yes. Yep, you first. So again, I know that I was talking about that I am a researcher, and I will say that my commitment to my community is doing research that brings forward solutions to our community. I'm very deliberate about my work really focusing primarily on African American populations, work very closely with different community partners so that they inform the research that we do. And so they help give us strategies for recruitment. They give us strategies for different things that people might like in terms of incentives for their participation. And so to me, that is my commitment, because there's not a lot of research on us that is for us, designed for us to help improve our health. And so that is, my entire reason for going back to school was really to just make an impact in my community and use research as one way of impacting our health.
I think my way forward is to make sure that when we are in spaces that we are including everybody that we can to be at the table. People with disabilities, people with chronic illnesses, and making sure that their voices are highlighted and heard and implemented into whatever policies, programs, practices that we develop as community members.
And my path to move forward with disparities within my community is to help decrease the stigma that's associated with mental health. I want to advocate to let everyone know that it's okay to not be okay. And it's something that I'm very passionate about. And always willing to talk about mental health, and I am very approachable.
I know we spoke, Dr. Felder, you spoke a good bit about voting and why that's so important for our community and how it determines a lot of our overall social determinants on how we experience life. I do want to, and maybe you can speak on this or any of the ladies on the panel, but in what ways can policymakers and community leaders work together? Because a lot of times, in maternal health, we're like, yay, we just need to get together as a community and all the moms birth at home, and that's really not a reality because we don't have that many midwives to cover that spectrum. So we have to bring all the voices together. We have to bring the hospitals into the spaces of the community in the spaces of the hospitals, so that this can be an intersection of a system that we work together to improve together. So when you're looking at your particular field of expertise, what can policymakers do to help community leaders to help change what's happening in our community as Black and brown families?
So kind of going back to my statement around building community in the work that you do. So I think that policymakers should be at the table with us, whether you elected them or not. Because I think part of the issue is that I feel like we're just at a place politically where people are speaking past each other. People are not listening to each other. Everybody has their own sound bites. But I think that when we actually engage at the table together, you end up finding out that you tend to have more in common with people than you may anticipate. And then I think you also learn like the process of politics. Everybody isn't supporting everything because they believe in it. Sometimes it's because they need to be reelected. And so it's that simple sometimes for why people are supporting different things. So I think that, at the table, to your point, I think policymakers need to be there, organizations that provide resources, and of course, always people with the lived experience. They need to be there as well, sharing their experience, because those stories really do make an impact. I think there's been a lot of conversation about the impact of storytelling and the importance of that, and it absolutely makes an impact on politics, but also on funding.
Yeah, lived experiences in storytelling right now is very impactful in the spaces of change, because the truth is that our medical systems can't run without patients, and the patient voice will always be at the front of that table to implement change and quality improvement. And it is a huge part of the work that I carry with me every day, is ensuring that those lived experiences are represented. We're gonna go back a little on Black maternal health, because Black Maternal Health Week just closed out April the 11th through the 17th. And I feel like there is some conversation that may be necessary in that space with Black maternal health and how it impacts us. I know many times I have many friends and family members who've had miscarriages and stillbirths, and they don't often talk about those things. And I feel like, we talked about mental health and things being a stigma, what things impact us. A lot of times there are preconditions and things that happen in those spaces that could be preventable. Statistically, 80% of those who are dying as Black and brown women in maternal health from issues with maternal health were 80% preventable. Like, that is a huge number of women that are dying if the right actions would have been taken place ahead of time. And Ms. Petra, maybe you can talk about this a little bit. I can too, but I just recently hosted a mom's market event with resources for women to visit who were going through pregnancy or going through that journey of thinking about getting pregnant. And I had a lot of seasoned women to come up to the table who wanted to know about what preeclampsia was. They knew about preeclampsia, but the terminology was different, so it changes over the years of what preeclampsia, and a lot of women are impacted by it. We talked about heart disease, diabetes, cardiovascular disease. It is going to be evident that the things that are experienced out of pregnancy are going to be the things that are going to be heightened in pregnancy for women. So can you talk about preeclampsia and what that condition is and why it's so important to detect it early in pregnancy?
Okay, so let me please start out by saying that maternal health is not my area of expertise, but I will try to give you guys as much information as I can remember from my L&D, labor and delivery days. So when we look at preeclampsia, it's where, your blood pressure is like record, number, it's just really high. You have a lot of swelling, and it's a very dangerous situation. It's, generally the only way to treat it is having the baby. And a lot of times, baby's not ready to come to 39, 40 weeks. So it's record number high blood pressure. You have a lot of swelling. It could cause you to have seizures as well. So again, it's literally considering like it's a medical emergency, or it can be. It's very important to seek treatment as soon as you notice that, hey, I'm swelling more than I generally, would have ever been swelling while I'm pregnant. Call your OB, call your, midwife, let them know what's going on. Because again, us as African Americans, we have a higher mortality rate. So it's very important to, keep that open communication with your OB. So, and again, that's not my area of expertise.
No, she hit it on there. I mean, it's very much so just high blood pressure in pregnancy. But there's also post-preeclampsia as well that is very dangerous. And when you read about a lot of the stories that are happening, a lot of the women that are in the limelight when it comes to exposure to these stories, it's preeclampsia, it's hemorrhaging, it's all these things that are coming up that are a huge part of what's happening to our women in the community. So I want to talk a little and kind of turn wheels a little bit on hormones, because we talk about overall health of women. We talk about hormones a lot, and there are so many layers to hormones for what I've learned just in my time of asking questions to my physicians. And we say, it's generic that I have a large neck because I have thyroid issues in my family. Like, these are things that we have been told. Like, I know that my mom has this cut under her neck, and as a kid, I remember she had a surgery. I didn't know it was thyroid surgery until later when I got older. But these are, thyroids are a hormone, and, hormones control so many parts of our bodies that we, eventually have symptoms of things that come up physically that are a part of that. So how does hormonal imbalance affect mental health?
I would say that, so with hormonal imbalances, as we age, as women, we deal with hormones. We deal with the hot flashes, the mood swings, and sometimes you don't even have to be in like a menopausal or premenopausal state. Sometimes you have the like the premenstrual moods for those who are of younger ages. So with the hormones, it increases your risk for mental health. But again, like Tisha was saying, is that like with your thyroid, this little middle gland here in the middle of your neck, and you saw the cut on your mom's neck, a lot of times people have what they call overactive hyperthyroidism, or it could be underactive hypothyroidism. And a lot of times that can also mimic symptoms of like mental health, such as depression, and you need to get that treated. So also with your hormones overall, a lot of the mood swings could again mimic mental health, such as like the depression. That's one of the biggies. Having the fatigue. A lot of people may say, hey, I just, I'm not feeling like myself, and they will all chunk it up just to be hormonal. However, you may need to get some type of hormonal replacement. And I would, defer that over to whether it could be your primary care, but most likely it would be like your GYN, your gynecology services. But again, hormones, or should I say hormonal symptoms can very much so mimic mental health symptoms. And some people would argue that yes, there's a connection, and some people will argue no, there's not a direct connection to mental health. But they very much so mimic each other, and I do think there is some type of correlation with that. But again, as we get older, and I'll say for myself, because I am almost 48, and the hot flashes are really real, and the mood swings. So yes, getting the hormone therapy or seeking treatment is very important.
So where you are as far as, your particular areas of focus and career, do you know, just bringing it back to state level, because this is where we are, do you know of any statewide efforts to address social determinants? Any new programs or any things that are coming out that are recent to us that we should know about?
I'll speak as far as DHEC. DHEC collects a phenomenal amount of data. If y'all haven't been on the website, it's so much data out there. They're collecting data around food deserts and the availability of farmers markets. We understand based on deserts that there's 14 counties in our state that don't have access to OBGYN services at all. And those are primarily rural countries. So DHEC is working with our legislators to bring mobile clinics for OB services to those counties without them. We are also providing mobile, I'm gonna mess this word up, breast cancer screenings. And we're delivering that all over the state. And so there, and we're also employing, activating, and disseminating community health workers. And this is a big initiative around our state, across sectors, because COVID helped us realize that there is power in those trusted voices. And if we equip those voices with the tools that they need to go out into their networks, we're going to see an astronomical improvement in overall health. So DHEC, as well as other hospital systems like MUSC and Prisma, they are rolling out community health worker programs and trainings to provide those people in the communities to help educate and prevent chronic diseases.
I'll just add that I was at a meeting recently, and I believe it was the Eau Claire Cooperative that is also implementing within their centers ways of screening for social determinants of health. And so they're being more deliberate about with their patients when they come in, they find out issues around food insecurity, mental health, all those different things. And so they screen for that, and then they've partnered with community organizations to help their patients.
So I can't have a panel without talking about nutrition, because I feel like it's a huge part of, our daily. I can eat collard greens and fried chicken and rice and gravy and cornbread every day, macaroni and cheese, yams, all the things, black eyed peas. I can go down the list because that's how I was raised. Like, that's what my family cooked. But it took me to be intentional about my own health and educating myself about nutrition. What does exercise look like every day? What does it mean to be active when you got 4 kids and all the other stuff going on? But all of these things are important when it comes to maintaining the whole body. So I know you mentioned deserts, and deserts are such a real thing here in South Carolina, that there are food deserts where people can't get anything but packaged food, and packaged food we know is not healthy. They're not able to get fresh fruits and vegetables, and then a lot of times they don't know how to cook them. So being able to teach them how to use them as well is as impactful as it is for accessibility. So I just want to talk about nutrition. I know that you do some breast cancer research and a lot of research. What can we do as a community when it relates to nutrition and being able to teach our families about what healthy eating looks like?
So one thing I'll say is that really with many of the leading health conditions that we have in our community, healthy eating is part of that solution. So in terms of, again, just about the balance of the fruits, the vegetables, you talked about having access. So I know there's a program called Food Share that provides fresh fruits and vegetables in communities, and they also, I believe, started offering some classes to try to help people understand and provide them with recipes so they will know how to actually prepare those. I will say also in terms of breast cancer, I will add that a lot of my work focuses on breast cancer, but also breastfeeding, which is our first food. And that is another area that there's been some research demonstrating the relationship between certain forms of really aggressive breast cancers and breastfeeding. And so I think that's also, it's a much bigger conversation for another day, but I will say that is also an area of nutrition. That is our first food, and not only does it impact the health of our infants, it also impacts the health of the parent.
And I'll also add, DHEC is partnered with Department of Social Services that administers food stamps or SNAP benefits. We provide SNAP education, and we have tool books and recipe books on how to get those SNAP beneficiaries educated on what to do with some healthy foods that they get. And this is why it's important for Black voices to be included. A lot of those recipes don't fit into our culture, right? And so we're not gonna put raisins in coleslaw, right? So it's important for us to be at the table when developing these recipes, to be like, all right, this is one way to use a sweet potato, and this is how we traditionally use it. But let's think about ways that we can incorporate the traditional use and the healthy use in that same way. Akua Page down in Charleston, she has and this is not a plug-in, but she has a business called Fitness in the Geechee way, and that's the Geechee way that we say fitness. And she is a juice bar, a mobile juice bar, and what she is doing is she is bringing nutrition education to communities where we don't necessarily see nutrition education. And so she will take some of those same recipes that are in our SNAP education recipe book and make it more applicable to our culture. And so that's one of a highlight project I wanted to share with y'all that DHEC is doing, because it matters, and she's recording videos for us because it's going to matter for us to see Black hands fixing food, and to make sure, like, oh, I can somewhat trust this recipe. I might not all the way trust it because I don't know about them raisins in the coleslaw, but we can get somewhere with this. And so that's why inclusion is so important in developing these programs.
In addition to the nutritional factor when it comes to our chronic health conditions such as diabetes, hypertension, high cholesterol, so I would say, it would be very beneficial to, again, look at recipes that does not include like the fatty pork foods. Yes, you can make the greens taste good, but you could use like turkey-based meat. There are alternative ways nowadays that we all have access to cook healthier foods. And I would also like to add that just because your mom, your dad, if they have diabetes, yes, your risk is greater for diabetes. However, please note that you don't have to have diabetes because your mom or your dad, because they have diabetes. Just know that your risk is greater, but you can eat better, exercise, keep your weight at a good level, and you would not have to worry about diabetes or the hypertension or the high cholesterol, which again affects your cardiovascular, such as heart attacks, strokes. So I just wanted to add that.
So we are gonna, I'm glad your hand is raised, because we're gonna open up for questions and answers for anyone who has a question in the audience. She's coming with the microphone for you.
Okay, in 2016, well, anyway, I started having seizures at the age of 40. Okay, in 2016, I had to have brain surgery. So my question is, because I have been through 3 neurologists, and I don't feel as if I'm getting the service that I need to get. I even asked the surgeon who did my brain surgery, when will my brain start? How long will it take for it to heal? The answer was, they don't know. Okay, I have not, I guess what I'm trying to find out is who on a state level that I can go to actually find out about neurologists that's in our state, whether it's here in Columbia, I have to travel a little further, that can actually give me some answers so that I'll know directly, because what I've been doing is what I've been doing on my own, not actually what the doctors are saying, because I'm not getting any answers. To the point where if I have to travel out of town, out of South Carolina, that I will. You know, I've been doing exercise, and I've been trying to eat right. So far, I think I'm doing good. But I do have miniature seizures that I'm going to have for the rest of my life. I'm not getting any answers. So on a state level, what do we do when something like this occurs and you don't know actually what to do medically, and no one is really giving you an answer, including the neurologist that you're going to?
Okay, thank you so much for that question. I'm going to try to answer it to the best of my ability. And again, I am not a neurologist. However, the advice that I would give you is that, you know, I certainly appreciate you advocating for yourself. If you feel like you're not getting the answers to your question, because I would say, and I'm going to say this as a healthcare provider, there may not always be a definitive answer to a healthcare question as to like, well, when is this going to stop, or when is that going to stop? Because a lot of times it differs. You know, everybody, you know, your body's different. But what I would say in terms of your question, I would be happy to recommend, you know, neurologists within Prisma Health, because I am very proud of Prisma Health and what they do. And hopefully, you know, that could be your start there. I'm not sure who you're following with, but I would be, you know, very happy to answer or help you get to where you're trying to get to with your neurology services.
I'll also add that maybe reaching out to associations like South Carolina Medical Association, they may be able to point you in the direction that you need to go. And who the experts are in our states, but also be able to tell you there's no experts in our state on whatever the specific issue that you're experiencing is. So that might be a good place to start as well.
Thank you so much for coming and sharing this information with us this morning. You've covered a plethora of information from a health standpoint that I have just been captured by and simply reminded of from the time that I have been alive and been around. And the thing that I really want to get to is I have advocated oftentimes for many persons going to the doctor, particularly senior citizens. And what I've found is the physicians speak to these elderly people in particular with doctor speak. And now I'm a college-educated person with a biology degree and beyond. And sometimes when I hear the things they share with the patients, they are really talking beyond their heads and talking to them like they are doctors. And I'm just wondering if that's something that's planned in the medical field, and I'm particularly speaking of white doctors, Caucasian doctors and others. Is that planned to just ignore us from a health standpoint, or is that just the way they operate on a regular basis. Is that something you're familiar with? Because I find it very disgusting and distrusting of those medical professionals.
That is such a good question. Before I came to this role at DHEC, I was at the Attorney General's office providing human trafficking coordination for the state. And what I noticed, I went to a training to provide some education to doctors in residency, that they really have, let me pull it back together. They don't get training on the how to serve the people that they serve. They get training on the technical part of practicing medicine. And so it's really important for our physicians and residents that are coming out of their training to get training on social determinants of health, on how to be culturally competent and walk into a space with humility and knowing that you can't speak medical jargon to this lady who has a high school degree and isn't going to, we just don't speak that language. So language access is really important, but they have to have that additional training on top of the technical training that they get. And I don't think that it's a part of their curriculum at all. Some doctors get it, but that's what Dr. Felder was saying. It's important for us to have to build up our workforce with people that look like us and have similar life experiences, because some of it you can get trained, but a lot of it is lived experience. And so we have to enter these spaces in order to really understand that cultural humility part.
I was recently reading a research document that talked about the vulnerable communities that were often a part of the systematic system that was built for healthcare. And of course, elderly was a part of that group, African Americans, when we talked about the Tuskegee project, as well as military vets. And my husband is a soldier, and a lot of the things that take place when it comes to vaccinations and things, they're usually the first ones to get that stuff. So, recognizing those most vulnerable populations and ensuring that we're showing up in those spaces to be their advocates is important. So thank you for, attending doctor's appointments. I do the same thing with my grandparents, but it is so necessary. Don't let them go to the doctor alone. We have no idea what medicine they're putting them on and giving them, and they go home and take it, and they're unadvised. So just being able to support and be that ear to someone that's connected to you.
Can
I was going to point to you because I wanted to just make a plug. So I'm in a college of nursing, but I am not a nurse by training. And I'm sure you can attest to this, that nurses are actually trained to provide holistic care. Medical doctors really have a very focus on either particular disease, body part, like whatnot. And so I would just suggest as well, following up with the nurse. If you have questions and the physician may not be answering, ask the nurse a question, see if the nurse can better explain something that was shared in those appointments as well.
Yes, so, just to, again, piggyback on everything that you guys have said up here, is that during your appointment with your provider, again, whether it's the MD, the NP, or the PA, you need to understand your appointment. So it is absolutely okay to say, hey, I need you to break this down for me. I need to be able to understand this in my terms, okay? Because again, not all of us are college educated, okay? And it's absolutely okay for you to just say, hey doc, hey PA, hey nurse practitioner, I didn't understand anything you said. And because you're given like a new prescription or, new pills to take, ask what they are for. Ask why are you taking them? You know, what are some side effects? How long will I have to take this medication? Don't be afraid to advocate for yourself at all. You have the right. It is important. Your health is important.
I'm gonna use that at the doctor's office. I want to understand the appointment, not the assignment. So you're gonna take
And
that
that
with
is so
us.
true. They on the schedule now. The doctors did used to be on that 15-minute schedule.
Oh,
To
that-
the other
that's
staff knocking on the door,
Mhm.
saying like, your time is up. I let them knock, and I'm still gonna get my time.
That's right.
I was the timekeeper, and I realized that we're now over time.
Oh, yeah.
So I just have 2 questions. I wrote down notes, and then we'll let our Women's Day chair come forward. You talked about preeclampsia and the blood pressure issue. Can a woman take blood pressure medicine while she's pregnant? That's one question. And the other is for Lieutenant Walker. Is there a place where you could report suspected trafficking? Is there a website online, a number you can call where you can report it?
I'll answer the first question with preeclampsia. Yes, you can, and there are other things that are used in that process when preeclampsia, most of the time the woman is watched a lot more. You're going to doctor visits more frequently. I know in the hospital setting, they use magnesium sulfate to help with preeclampsia as well when it comes up as an issue in pregnancy. So there are some interventions that can take place. I know that there is a huge study right now with aspirin, like being a part of controlling preeclampsia or high blood pressure in pregnancy. So there are some measures and things that can be interceded before it gets to a level of catastrophe, for sure.
Now for me. Yeah, there's definitely a number. I have a few flyers here, actually, I can leave with the church and they can get them out. But there is a National Human Trafficking Hotline. But first and foremost, if you see something going on, call law enforcement, 911. Get us there so we can at least stop something before it even gets too far.
And then also for that sex trafficking question, and I used to work for DSS too, y'all. DSS is responsible for investigating child trafficking cases, and so you can do it online, you can call the number, but you can report to DSS when you suspect that there's children being sex trafficked as well.
And what happened to the village we used to have raising the
Oh, my
children?
goodness, the village is...
Children raising themselves.
Yeah, the village has definitely changed. I am struggling just trying to create my own village. So we have to create our own village now. It's different from when I got off the bus and could go to grandma's house and auntie and uncles and cousins were all in the same community. Now we've been taught to move away from our family, and that's how the village became separated.
Since I've been there, I worked with it before and I stopped and I came back, is that with kids, it doesn't matter whether you work in the office, in the classroom, in the cafeteria, whether you have a college degree. If you have interest in kids, then you see things that go on within the schools and within these kids. Now I work with special need, and it have really given me an outlook more so with all the kids, because you see the difference. And we do need, I know when we talk, we say communities, and a lot of people are putting themselves into communities. And if it's a child, including grown-ups, if they ask a question, first thing you go to these businesses, what is your zip code? If you're not in the zip code that they are working in, they don't give you no answers. And it's sad, but we need to get back to it. It doesn't matter where you stay, what community you're in. If you're seeking help or trying to help any kids or any people, they need to answer those questions or help you some kind of way to get it.
Everyone. I am not going to be up here long because I think there's been so much said today that we can all go back and find something from minority health disparity perspective that we should be focusing on, if not in our communities, for ourselves. I thank our esteemed panelists for sharing, first of all, for all that you do in our community, and also for sharing your valuable insights and expertise with us today. We are truly thankful for you for that. Only thing I'm going to end because we are over time, but our theme is going forward with optimistic expectations, women of God stepping up with faith and anticipation. I'm anticipating that from this symposium, we will be able to better ourselves. So with the information that you've provided, thank you so much. And with that, and the committee, thank you for the work that you put into putting this together. And we look forward to our remaining Women's Day activities, but this definitely was something for us to be proud of today. Those of you who are in person, please stay after closing. We do have some door prizes, but I will turn it over to whoever I need to turn it over to for closing. Who, me? No, well, I'm going to ask Reverend Williams to deliver a benediction in the absence of our pastor. But thank you all for coming. Those of you who are virtual, thank you all for joining in virtually. And again, panelists, may God bless you all.
Pastor, and in the interest of time, we're going to get you out here, but I couldn't let this go without saying, let's give them another big round of applause, because we gained a lot more information, because we are not being equipped like we used to be. We got to start back being equipped so we can pass it on. So again, give them another hand. Thank you. And in the absence of our pastor, let us prepare for the benediction. May the saving grace of our Lord Jesus Christ, the love of God, may it be with us henceforth, now and forevermore. Let us all say, amen. Go and have a great day. Thank you.
Hand up. You put your hand back up. All right. 8637. 8637. 8664. 8664. 8638. 8638. Okay, Reverend Chicken. 8662. 8662. 8635. All right. 8633. 8661. 61 in the back. Hands up. 8649. Okay. She got it. And in the back, Tasha. 8660.